Hi, everybody. Welcome to week 2. Here is just going to be a quick overview of what week 2 will be covering. Also, though, I do want to show you the windshield survey template because that was actually not posted when I did my first overview. So in the longer video, the first overview, I did go over the whole assignment in general, but I did not have the template to review with you, so I do want to just kind of pull that up and show that to you as well. But we'll begin, as we always will, looking just on our Moodle site, and everybody's done a great job. I'm recording this as of Sunday, and I have read and responded to all of your posts, and I see that many of you are working on your replies. I will be sure, I'm usually pretty good about grading, hopefully by no later than Wednesday. You'll have your grades for your first week's discussion post. You guys did a great job on the initial review. And this week we do not have a discussion post. So you'll see week 2 is about social justice and health equity, which I'm sure is going to very much tie into some of the things that you might witness when you do your windshield survey. The topics this week are social justice and community public health nursing, health equity, and also a look at social determinants of health, which many of you already have referred to in your week 1 discussion, so something that you must be familiar with. So we're going to take a deeper dive there. Our learning objectives are going to be to examine the role of social determinants of health in shaping public health outcomes to inform nursing strategies for promoting health equity in communities. This is going to be linked to our student learning outcome 1. Assess the impact of systemic racism and social injustices on health disparities to develop culturally competent nursing interventions for diverse populations. That's going to be linked to our student learning outcome 3. We're going to apply findings from a windshield survey to identify community-specific social determinants and health equity challenges that influence public health nursing practice, which is linked to our learning outcome 7. And we're going to integrate the principles of health equity and social justice into communication strategies to advocate for improved public health outcomes in underserved communities. Okay, so we're going to begin by looking at and meeting these objectives by looking at our readings. So you have a few websites here. So the American Public Health Association, looking at social justice, the American Public Health Association website and looking at their information on health equity, and then looking at the social determinants of health. And this is on the Office for Disease Promotion and Health Disease Prevention and Health Promotion on Healthy People 2030. You'll see a separate area for social determinants of health, which I'm guessing all of you have probably seen before. There's a few videos as well. What is health equity? What makes us healthy, understanding social determinants of health, and how do social determinants impact public health. So please watch those videos. And finally, there's a little webinar, or not too little, it is 90 minutes. It is free to watch, but if you wanted to get continuing education credits from it, you do have the option to purchase that as well. All right, so that is going to be our readings and websites, etc., videos for this week. Then I'll just point you to here is going to be where you will submit your windshield survey when you're completed with that assignment. So you will be doing, and I'm going to pull up this template. So this week you'll notice there is no discussion post. So you will just be submitting your assignment by next Sunday at the final assignment is done and due Sunday evening. Okay, I'm just trying to reshare here. I want to show you on the assignment. Okay, so this is due at 11:59 Sunday, September 7th, right? So this is when you're going to do your windshield survey and observational assessment. We talked about this. I did go over this already in your bigger overview, okay? But just to go through kind of the basics, this is going to be 6 hours, account for 6 hours minimally of your whole entire clinical component for nursing 408. You should do an observation in the day and evening. You're going to go into your city or town and using the template and identify a street or a neighborhood that would benefit from a public health education initiative. And you will then need to write up all of your findings into a paper. So what's going to help is actually using the template, and I'll show that to you in a minute. You're going to use the template to help you gather the data. It gives you prompts of the things that you should be looking at. Once you have that all completed and you have that template, which you do have to fill that in, and submit that as an appendices of your paper. So you will be submitting that typed as well as part of your paper. And remember that all these hours that you do, you're going to keep track on that clinical log. All these hours are going to count. Okay. So in your paper, it should be APA 7th edition. It should be well organized. There's a separate rubric for this, which is in your syllabus. You're going to speak to all the categories that are listed in the template. And again, put the template in your as an appendix. You're going to include any data, and you're going to include the data, things like you might find crime statistics, housing statistics, school statistics, and you're going to cite all those in APA format on your, oh, it has it right here. I was saying that off the top of my head, but, and you're going to put that in on your reference page, document your log, and submit the clinical log hours at the very end with the self-evaluation as well. Okay, so what you're going to, and that's all here, your completed windshield survey, okay, your template, right, and your analysis. And based on your observations, include all the data in your template, right? But you also want to make sure that you speak to what your findings were, as well as when you're doing your windshield survey, noticing an area where you're going to be able to disseminate your project, which means to do your presentation. So it might be something like a senior center or a library, etc. Okay, so it's going to be a single document when you're all done that's going to be uploaded for this assignment due Sunday. Okay, so I'm just going to pull up the template. So what you'll see here on your template here, you need to, this is really part of what public health nurses do, right? It would be to be able to identify issues, plan for services, and effectively plan, you need to know what is out there and what the needs are. So you can conduct the survey from a car, and it's going to provide a visual overview of the community, and you're looking for what the conditions are and what are the trends that could affect the health and the health of the population that you are studying. And here you're going to fill this in. So on the left-hand side are your categories and questions to ask. And if you ask or add additional things, that's okay. But please do try to answer these questions. And here's the area over here on the right that you can put your data in. And this is also where you're going to support this data with information that you're able to find and reference in your reference page. Okay. There is no set, and you'll see this goes through a lot of categories here, right? So it'll give you a lot of good information to then feed the data in your paper. The paper does not have a set number of pages. It's really quality over quantity. Please just make sure that you follow the rules of the assignment, and also always go back to that rubric, which I won't go through again. That's in your syllabus, but make sure you are referring to that and really grade your own paper to make sure that you are at that exemplary column and you've remembered everything that you should for the paper. When you have a paper like this due, typically I would give me a week for the grading of that, and I will have that back to you. I will have the scores with the rubric, but I also do like to make comments directly onto your paper and send it back to you as an attachment in your email. So that's what you have to look forward to. I very much look forward to hearing and seeing what you come up with. If you have any questions as you're starting to embark on this activity, please feel free to reach out. Whether you have a question just by email, I can answer, which some of you already have, or if you want to set up a call, Zoom, etc., please just let me know. Okay, I do check my email frequently. So good luck to you, and I will see you, if not before, I will see you next week. Have a great week, everybody.